The Global Allergy and Airways Patient Platform believes we can all live better. Today we're going to talk about type 2 inflammatory diseases, which are often referred to as eosinophilic-driven diseases, or EDDs. You can think of type 2 inflammation as an umbrella term. EDDs sit under that umbrella. Do you live with inflammation? How does that feel for you? In just a few minutes, we'll help you learn the basics about these conditions. Type 2 inflammatory diseases can take several forms. Elevated eosinophils, which are a type of white blood cell, often play an important role in these conditions. Eosinophilic immune dysfunction is responsible for the recruitment and activation of eosinophils and can contribute to these conditions. This response is due to an overactive immune system and can cause asthmatic problems and other diseases. The immune system, lungs, stomach, and skin can be affected in different ways. Often people live with two or more of these conditions. There are many type 2 inflammatory diseases. In this learning module, we will cover eczema or atopic dermatitis, chronic spontaneous urticaria, which are chronic hives without a known cause, eosinophilic esophagitis, eosinophilic gastritis, chronic rhinosinusitis with nasal polyps, which we'll call nasal polyps, and severe asthma. We'll start with a look at eczema. Eczema is an inflammatory disease with inflamed, dry, thickened skin and constant, intense itching and scratching. Symptoms usually start within the first 5 years of life, often between 3 and 12 months. With time and treatment, as children mature, eczema will often go away, but it sometimes continues into adulthood. Urticaria symptoms, such as redness, hives, swelling, and itching that last longer than 6 weeks, are called chronic spontaneous urticaria. Discomfort can last for several months or years, and sometimes even for decades. Angioedema, which is swelling of the skin, can also occur, especially in the facial area, on the hands and feet, and in the genital area. Eosinophilic esophagitis, or EoE, is an immune condition that affects the esophagus, the tube that takes food from your mouth to your stomach. When the stomach is primarily affected, this is called eosinophilic gastritis. EG, or eosinophilic gastritis, is a rare condition that affects the gastrointestinal tract, particularly the stomach and small intestine. Common symptoms of the condition include diarrhea, abdominal pain, and nausea. Nasal polyps present in the form of soft, non-cancerous growths that appear in the lining of the passages or sinuses in your nose. Nasal polyps can vary in size. If they're small, they might not cause any symptoms, and you may be unaware you have them. However, large polyps, or multiple clusters of polyps, can cause symptoms like congestion or difficulty breathing and can even block your nasal passages. Aspirin-exacerbated respiratory disease, AERD, is also known as Samter's triad, and this is a complex chronic medical condition involving a combination of 3 key factors: asthma, aspirin allergy, and nasal polyps. AERD often has a high impact on a person's quality of life. Severe asthma is a type of asthma that does not respond well to standard asthma treatments. The symptoms are more intense than regular asthma symptoms and can last for long periods. People with severe asthma often find their symptoms persistent and difficult to control. Having severe asthma can have a major impact on daily life, affecting everyday habits, work or school, and social life. It can affect both children and adults and can develop at any age. Severe asthma affects less than 10% of people diagnosed with asthma, but accounts for approximately 80% of all emergency department visits and hospitalizations. If you think you have one of these conditions described above, discuss your symptoms with your healthcare provider. GAP believes in empowering people around the world and wants you to live better. For more information, go to gap.org. The mission of Global Allergy and Airways Patient Platform is to globally support and empower patients with allergies, airways, and atopic diseases by protecting their rights and insisting on the duties of governments, healthcare professionals, and the general public. Thank you for listening. Join us for more GAP Health presentations.